So thank you very much for opportunity to be with you again.
Please put in full screen your presentation.
Full screen. Now, better?
Perfect, thank you.
Okay?
Okay.
Okay. I will talk today about connection between air pollution and stunting, or is there a connection? I think that we saw in previous presentation that urban air pollution is one of the main environmental health challenges in pediatrics. And I must point that children and infants are among the most susceptible to many of the air pollutants. So, I think that maybe Zorana said, but I agree that more than 95% of the world children under the age of 15 years, and it is approximately about 2 billion children, breathe unhealthy air every day. So, the number of children younger than 5 years who are stunted was about 34%, or 59 millions, and 33% in sub-Saharan Africa in 2011. So, we will speak about stunting as the impaired growth and development that children experience primarily from poor nutrition, repeated infection, and inadequate psychosocial stimulation. According to WHO child growth standards, children are defined as stunted, that means with growth retardation, if their height for age is more than 2 standard deviations below these standards. Globally, more than 160 million children under 5 are stunting, and Serbia has made some progress towards achieving the target for stunting, but even now 6% of children under 5 years of age are still affected.
Sorry,
among Roma population.
We are still looking at the title slide. Is it okay?
Okay, it's okay.
Thank you.
It's okay. Among Roma population, the prevalence of stunting is about 20%. Outcomes associated with stunting include increased risk of mortality, increased disease risk, then diminished ability to learn, and lower school achievements, and reduced lifelong productivity in later life. So, child linear growth is a complex multifactorial process with a high risk of growth impairment occurring between conception and 2 years of age. Beside genetic factors, poor water, sanitation, and hygiene conditions are thought to be a major cause of stunting. Air pollution has been largely ignored as a potentially important cause of stunting. So, stunting can begin in utero, caused by intrauterine growth retardation, or the programming of later growth, or both. So, we want to know the potential relationship between air pollution and child linear growth. Our aim of this study was to examine evidences related to potential impact of ambient air pollution exposure on stunting or on growth. We did a systematic review of novel data sets extracted from PubMed and Google Scholar articles. More than 4,050 articles were included about air pollution and stunting. But after title and abstract analysis, we have only 266 articles with these items. And then we evaluated only 18 articles on this specific theme, and last data was from April 2021. We can say that to date, evidence for a link between air pollution and linear growth has come from retrospective and observational studies. These studies has no intervention. And these studies focused mainly on prenatal exposure to ambient air pollution and adverse birth outcomes such as low birth weight and preterm birth. Only a few studies have addressed links between air pollution and postnatal growth. I can say briefly that we analyzed, for example, the study from China published in 2017, where the authors found a significantly increased risk of preterm birth with increase in PM2.5 exposure through pregnancy. And also the association between this exposure and term low birth weight is also found. Then we also analyze one study from London City and the Greater London area that that included more than 500,000 live and still births, and the exposure to higher levels of ozone and primary traffic non-exhaust related PM2.5 during pregnancy may increase risk of preterm birth and stillbirth. Moreover, we analyzed another study from USA. It was a meta-analysis and systematic review on 57 studies, including a total of 32 million births, and exposure to PM2.5 or ozone was also associated with increased risk of preterm birth. The subpopulations at higher risk were persons with asthma and minority groups, especially Black mothers. We also have one paper from Serbia, influence of air pollution on birth weight from Stankovic et authors, where they conclude that exposure of pregnant women to outdoor air pollution and wood heating systems had influence on the occurrence of low birth weight. And as I told before, only a few studies have addressed links between air pollution and postnatal growth. In BMC, public health journal. We can saw systematic reviews with meta-analysis with people and child from 0 to 58 months for stunting and all-cause mortality connected with the exposure to household air pollution from cooking. Also, we can point that there is also one study from Serbia, our study about effects of the air pollution on growth of school children. And we presented results in previous WeBIOPATR, I guess 2 or 4 years before. So after analyzing all these studies, I mean 18 of them, we can conclude and organize a conceptual framework of pathways from exposure to air pollution to child stunting. You can see that prenatal and postnatal factor of risk could be included in stunting. At first place, it's oxidative stress and systematic inflammation in prenatal period, and in postnatal period, there is very good connections with impaired immune development and function, with infection, clinical and subclinical, with nutrition, and with bone metabolism. But when we analyze all this study, we must say that much of the research done so far has been observational and focused on high-income countries rather than on low-income and middle-income countries, where exposures, as we can see, are generally higher. Also, the observational studies are likely to miss important explanatory mechanisms related to socioeconomic factors, lifestyle factors, and genetics. Also, we must say that high-quality randomized controlled trials are needed, also with individual exposure in low-income and middle-income countries. And to conclude, air pollution, among other risk factors, is connected with linear growth of children. But there is need for much more attention to this relationship, especially in prenatal period and first years of life. Current intervention studies will be contributed to a comprehensive multi-causal approach to prevent stunting. And this is another argument for tackling air pollution and improving of global health. I'm sorry, I had only several slides because the organizer told us to send presentation with not more than 6 slides. Thank you.
So, thank you very much for your nice and relevant presentation, Professor Nikolic. Are there any questions? Again, I have Saverio De Vito. I suppose that you cannot talk, so I try to read your written question. Thank you for this interesting work. May I ask if you are aware of any clues from these few studies on postnatal growth? Postnatal growth? I'm not sure to understand. Please.
Yes. We have also one more analysis done in India, for example, but that was also an observational study with no intervention, as I said before. After controlling for potential confounders, increasing of 100 micrograms through meter cube in PM 2.5 particles in the month of birth was associated with reduction in child hate. So that means that for an average of 5 years old girl, this represents a height deficit about a half of centimeter. So it was found that exposure to high exposure to PM 2.5 in the last trimester in utero and in the first few months of life are significantly associated with child height deficit. So there is not so much links documented between air pollution and postnatal growth. So that was the reason that we did some study in a niche city regarding growth in school children. But it was a part of the project with also respiratory capacity of these children. And we conclude, according to the results, that there is smaller respiratory capacity than lower height and lower weight for the children that lives in the places with higher air pollutions. But we investigate only sulfur dioxides. Then in that time soot high particles and also nitrogen oxides. So that was our contribution to this team.
So are there any questions? Thank you very much, Professor Nikolic. I have to thank all the speakers of this morning because everyone was strict in time, so now we have a very little and reasonable delay. Thank you very much for this interesting session.